Second day in Madrid. Top record number: 19,838 attendees participated to daily sessions. Hot topics: colorectal cancer, neuroendocrine tumors, hematological malignancies and immunotherapy. Immunotherapy is the future. What are current critical issues?
It is very clear that we must start thinking about precision opportunities in the clinical development of immunotherapy. A lot of work is now required to try to understand who are the particular patients benefiting from immunotherapy and which particular immunotherapy approach should we reserve for a particular disease type. And of course the focus has to go back again into the biology to try to understand which are the targets, what are the rules of the immunological game, so to speak. How does the immune system function? And how do we expect these T cells, either activated in vivo or ex vivo, to function once they identify their target? Clearly the rules in the solid tumors are expected to be different than in hematopoietic malignancies, and we must understand in detail these mechanisms so that we can manipulate them, and at the same time identify the right patient populations through robust biomarkers. So this is a very exciting area to be in. There's going to be a lot of work in the next few years, and this is how I present in my lecture of how we can start making sense of what are the available opportunities for patient selection, what are the available opportunities for immediate research, for biomarker identification, and really optimization of therapy based on the unique features of this new approach to therapy, which takes into consideration not just the tumor cell, but the whole of the tumor microenvironment.
Today's highlights. Up to 44 months. This is the longest overall survival observed in a phase 3 trial, achieved by treating patients with progressive advanced pancreatic neuroendocrine tumors with everolimus, a promising drug investigated in the RADIANT-3 study. The conclusions of the randomized, double-blind, placebo-controlled multicenter trial were presented by James Yao from Anderson Cancer Center in Houston. Previously, the treatment had demonstrated to be safe and to significantly reduce the risk of disease progression. During the extension phase of the trial, patients from placebo arm were allowed to crossover to open-label everolimus arm. Crossover rate, corresponding to 85% of patients from placebo group, likely underestimated true treatment effect on overall survival, commented Alexandra Fenn from University of Texas. There are many methods used to adjust for crossover, but no consensus on the best one, she said. Results of LUX-Lung-8 were presented. The trial is the largest prospective one that compared afatinib versus erlotinib as a second-line treatment of patients with advanced squamous cell carcinoma of the lung. 795 patients were recruited after a first-line platinum-based chemotherapy and randomized, balancing baseline characteristics. Afatinib treatment achieved significantly better outcomes in terms of progression-free survival and disease control rate than erlotinib, showed Dr. Gross from the University of Ottawa presenting the study results. What do patients expect from their medical team? How many challenges patients have to face? ESMO 2014 gives the chance to answer to these crucial questions. During the patient advocacy track, European patient organizations and bodies involved in patient care discussed vital issues and explored new strategic approaches to improve quality of life and care of oncologic patients. Lymphoma. Are we close to the end of histopathological classification and then the chemotherapy era?
As in the past, lymphoma was always leading the way, and in the last years it was more solid tumors that have more evolved in the sense of having targets and targeted therapies. The question was, are we getting there with lymphomas as well? And the answer was rather no. We don't really have specific targets that we can treat, but we cannot be too pessimistic. We don't have a specific target that we can target, except for a few exceptions, like hairy cell leukemia, in which we could have a target that is the same than melanoma, that can be treated specifically. But nevertheless, there have been a number of drugs which are non-chemotherapy drugs and that can target some lymphoma-specific pathway or even some lymphoma microenvironment components, which can, in the end, probably add to chemotherapy. So in the future, we might be able to treat lymphoma either by combining these non-chemotherapy drugs together or by combining one of these targeted pathway targeting drugs to chemotherapy.
Important results in addressing maintenance therapy in metastatic colorectal cancer. The combination of erlotinib and bevacizumab is effective in patients with unresectable tumors. This is the conclusion of JERCO DREAM study, presented the second day of Congress. Targeted monoclonal antibodies such as VEGF and EGFR are known to be clinically active in metastatic colorectal cancer, even though their combination has been correlated to adverse outcomes in several studies. However, this French study, a phase 3 trial, demonstrated that treating patients with erlotinib, an EGFR tyrosine kinase inhibitor, plus bevacizumab significantly prolongs progression-free survival and overall survival. In the trial, 452 patients were randomized for maintenance with bevacizumab or bevacizumab erlotinib, and the median follow-up was 50 months. Presenting the results, Benoît Chibaudel from Saint-Antoine Hôpital in Paris highlighted that the efficacy of combined regimen showed to be independent from KRAS status of the tumor. The maintenance therapy is effective even in mutated KRAS patients.